Warm welcome to the launch event for our CRN this afternoon. I guess two main purposes today. Firstly, it's to reflect back about the successes of our constituent networks that make up our new overall network, but also to start thinking through together some of the opportunities that our new network can bring for our patients, our researchers, the wider NHS, and also our industry partners. At Central Manchester, we're incredibly proud to be housing and hosting the new CRN. And I guess, as you all know in this room, it's coterminous with our academic health science network. So the geography of our network now covers Greater Manchester, East Cheshire and East Lancashire. And I really am delighted that we've got such a packed house here today, because so many of you and your colleagues in your organisations and your teams will have been absolutely central to the success of all our networks in the past. And hopefully you and all your colleagues will continue to be key enablers in ensuring that we have the expertise and infrastructure in place that allows high quality clinical research to take place, so all of us can contribute to moving the NHS forward. And I certainly feel across our network footprint, we've got a real strong track record for biomedical research. And that's based on the discoveries and expertise of academic colleagues, clinical colleagues, working across our universities and all our NHS institutions. And I think across our network as well, we have, I think, a really enviable shared infrastructure across our region, our hospitals, our community services, our laboratory facilities, our clinical research units. That gives us a lot of the infrastructure and the hard packing. What I think is just as important is the spirit of collaboration that you see across all our organisations. And perhaps at a time when some of the reforms over the last few years have moved organisations against each other in more of a competitive feel, I think our research endeavours are one of those really important elements that glue us all back together. And the reality is, across our network, we need that when you think about the health challenges and the inequality challenges that we need to face up to. Because I don't think there's one major health indicator that, if you looked across all our communities, the one thing that probably pulls us all together as well, we're probably in the bottom decile on all the big health indicators and all the inequality indicators. So it's absolutely critical that we harness the enthusiasm and expertise in this room and elsewhere to start moving ourselves forward. From a Central Manchester Foundation Trust point of view, to be able to host the CRN is a huge honour. And we've spent a lot of time with many other colleagues in this room just trying to create a really coherent package around so much of our research activities across the patch. And the goals that the NIHR have set out really align very much with our own corporate strategy and objectives in CMFT. So the major goals around attracting, developing and retaining the best research professionals to conduct people-based research, to commission research focused on improving health and social care, to strengthen and streamline all our research processes and governance. That's what we've been working at incredibly hard in CMFT for quite a while now. And we're all of us, each and every one of us, I think, really privileged to be in a position where we're operating in a really active environment around research at the moment. So again, across our footprint, I know it's not news to anyone in this audience, but we've been designated in Greater Manchester as one of a small number of academic health science centres across the entire NHS. So that gives us a real source of expertise at one end of the translational spectrum. Our Greater Manchester Academic Health Science Network, which is coterminous with our network, again, is an incredibly strong and powerful inclusive organisation. And we run our same domains and themes through our AHSC, our AHSN, that dovetails into all our work in the CRN. So a huge amount going on and a really big opportunity for us. We're also, I think, in a really good position across our network in that we've now got some really well-established arrangements across the whole north of England. And we've now had established probably for 12 months or so now, the Northern Health Science Alliance, which looks how we can pull together the expertise across all our networks. So as a major region in the north of England, we can start to punch our weight and be a real vehicle for delivery in terms of the government's health, wealth and innovation agenda. So despite all the pressures and the grim things that happen across the NHS, I think the area that we're all involved in, that we're here to talk about today, I think it's a hugely exciting opportunity that we have. And I think we've got that real privilege to drive forward different care models for, as you all know, people who, when they're at their most vulnerable and needy, when they're accessing the NHS, we can make a direct impact on their care and their health. And I'm sorry, because honestly, I could talk on for ages and bore you all silly on all this, so I will stop now. I'll come back later on to just chair the panel session that we'll finish with this afternoon. But don't forget, this is very much your event. It's an opportunity to meet colleagues, meet new colleagues and network and talk about what's going on.